everybody. This is Dr. Britt Talley Daniel, MD. I'm a neurologist and headache doctor, and today I'm podcasting on a new drug. It just came out in March 2020 called Vyepti, and it's for migraine prevention. So migraine is a genetic neurologic problem affecting 12% of the world's population. 20% of women and 6% of men have migraine. And for women, migraine is their most frequent medical problem, occurring more often than hypertension, diabetes, or arthritis. Migraine is also one of the most painful conditions in the world, and those conditions are childbirth, a kidney stone, and a migraine headache. Migraine is also one of the most disabling of medical problems. The International Classification of Headache Disorder, version 3, defines chronic migraine as 15 or more headache days a month, 8 of which have migraine features of being one-sided, moderate or severe, throbbing, and associated with sensitivity to light and noise and nausea and vomiting. Episodic migraine is defined as less than 15 headache days per month. So Vyepti, for migraine prevention. This drug has been approved by the FDA as the only infusion treatment for migraine prevention. It's been approved for both episodic and chronic migraine. Vyepti is the first intravenous monoclonal antibody inhibitor of calcitonin gene-related peptide, also abbreviated as CGRP, approved by the FDA. Well, how do you dose this stuff? The recommended dose for migraine headache prophylaxis is 100 milligrams IV every 3 months, although some individuals may benefit from a higher dose of 300 milligrams IV every 3 months. Dosing for hepatic or renal impairment is not defined, and pediatric dose is not available or applicable for this drug, but there are no black box warnings. The onset of activity in patients with chronic migraine, Vyepti 100 milligram and 300 milligrams was associated with a significant reduction in migraine days from the day after IV administration through week 12. So it starts working quickly. It was well tolerated and demonstrated an acceptable safety profile. Contraindications and cautions are only a hypersensitivity to drug or class, which is pretty rare. Adverse reactions. Participants in the clinical trial who received at least one dose of Vyepti had a lower rate of adverse events, which most commonly were nasopharyngitis and hypersensitivity reaction. Only 1.9% of enrolled participants discontinued treatment because of adverse events. So serious reactions are the hypersensitivity reaction, but common reactions are nasopharyngitis, a hypersensitivity reaction, angioedema, urticaria, which is itching, facial flushing, or a rash. Drug interactions. Wow, this is another one of these CGRP-related kind of drugs that doesn't have any drug reactions, which is really unusual, because most drugs have about 10 other drugs you can't take with them. Safety or monitoring has no need for a routine test or recommendation. Pregnancy lactation, caution is advised during pregnancy or while breastfeeding because there's really no human data available. The pharmacology is metabolism is through proteolytic degradation, and there's no interaction with CGRP IV. The excretion is unknown. The half-life is 27 days. The mechanism of action is blocking of CGRP, and it's a monoclonal antibody. The FDA approval was based upon data from the PROMISE-1 clinical trial for episodic migraine and PROMISE-2 for clinical trial for chronic migraine. Treatment benefit was observed for both doses as early as day 1 after infusion, and treatment benefits were sustained over a 6-month period with 2 quarterly doses. On my webpage at drmigraine.com regarding this subject, I have a table regarding the results of the trial. Comments. The data showed that many patients with chronic migraine can achieve reduction in migraine days of at least 75% and experience a sustained migraine improvement through month 6, which is clinically meaningful to both physicians and parents, said Dr. Peter Goadsby, a professor of neurology and a famous headache researcher at King's College London. and the University of California, San Francisco. Vyepti is a valuable addition for the treatment of migraine, he said, which can help reduce the burden of this serious disease. Dr. Deborah Dunsire, president and chief executive of the pharmaceutical firm that brought this out, Lundbeck, commented, quote, "With the approval of Vyepti, I am pleased that we're now able to offer a new intravenous therapy that achieves the key treatment of preventing migraine over time while also delivering on the need for earlier onset of efficacy. This is the first program that shows this early benefit." Now, a comment from Dr. Daniel. This medication is going to be given IV, so it'll have to be administered in outpatient IV infusion units or in a doctor's office, making it different from the ease of personal subcutaneous administration of the other 3 CGRP drugs that are available and been out about a year and a half, Ajovy, Aimovig, and Emgality. So these are my comments on this drug. If you want to see more about it, look at my webpage at drmigraine.com. Please click subscribe down there so we can keep in touch with each other. And God bless everybody with migraine. If you get on this drug, I hope it really works and helps you well.